What's up, you guys? My name is Miguel, fellow Xray Tech here, giving you your daily dose of radiation. In today's video, we are covering the more risky side, the more gray side of the radiology. And I'm not talking about imaging, I'm talking about the stuff you kind of do with discretion that maybe your job requires you to do. So, to give you context, I am a night shift X-ray tech. Been doing this for about 4 years at a Trauma 3 ER. So what I'm talking about is, obviously, when you take the X-rays on the portable machine, usually it's portable, or even in the main X-ray unit, you don't want anyone taking pictures of that, or even majority of the times the patient looking at it. You just want to put it online, get a report, that would be it. And then usually if the patient want a disc, if they're in the ER, you can make a disc, or they have to go through what is known as like the medical records and stuff, right? So certain people, let's say you're on the floor, the ICU doctor, he has the company phone, he has whatever stuff going on. I would say that a doctor, someone of higher power, if they take a picture, obviously you're not supposed to, but at some degree, you know that if he took a picture, like it's for like to help the patient out. It comes at a great field because sometimes the patient, you'll take an X-ray and they look at it and they have to go back to the desk to look at, what their prior looks like. And depending on your system, sometimes you got to wait all the way till you get down and put it online so they can see it. Obviously, if they take a picture of it, they can just compare right away. Occasionally, the X-ray we shoot looks way different, or maybe there's a big change and they can instantly, as soon as they compare, go in and probably save the patient life. That is something I've seen a few times. So I could say that is probably one of those kind of grayish fields of where you could allow something like that to happen. Same thing with rapid response, someone higher up in the, in the medical world that needs to take a picture of the X-ray just so they can compare, or they can communicate with the doctor and stuff like that. I could see how that you could maybe slightly kind of bend the rules, and that obviously, to keep us safe, what I would recommend doing is when they're doing the picture, don't look at it. Make sure you're not there, make sure your back's turned, make sure. So you could technically legally say, oh, they must have took the picture when I wasn't looking, or I was probably helping the patient when they did that. So legally you can kind of protect yourself, because they're not supposed to do it, but every single field does this. My lady, with her job, which she's a nurse, there's certain kind of things you're supposed to keep it this way, but there's certain things that are kind of grayish field that kind of bend the rules sometimes. Now, obviously, there's stuff that other techs have told me that completely is unethical. That there's techs out there doing stuff that you're not supposed to be doing, and it's completely pushing the ethics, and you could legit get fired or lose your degree. Stuff like that, I was nope, can't do it. There's certain levels that you should be careful. Certain techs don't know and they do it, and then it's until they get in trouble or until someone comes from a different hospital. It's hey, you shouldn't be doing that, this and that. So all this to say, it all kind of comes down to your discretion and how your hospital operates and who stuff going on. There's times here in the emergency room, especially the higher traumas, when it's there's stuff that to save time, maybe you do stuff a little bit different just to get the job done. It all comes with a gray field. It's hard to explain if you're not in the field or you haven't experienced certain things, but just know that there's times where they kind of push your ethics, or you got to be careful. It's like a thin line, and it's up to you. And especially if you're in the newer tech coming into the field, you always gotta
be careful. So yeah, it's been your boy Miguel. See you on the next one.